All right, good afternoon. How are you today?
I'm good, thanks.
All right, so my name's Tyler. I'm a student physical therapist at PCOM, and I'm just going to take you through your eval today, if that's okay. All right.
Sounds good.
So before we get started, I just want to ask you a couple series of questions just to make sure we're all okay, and then we'll get started. Okay?
Yeah.
So can I have you tell me your name?
Matthew Manani,
All right, and can you tell me what year it is?
2025.
Okay, and can you tell me where you're at and why you're here?
At Pecan, Georgia, this year for evaluation.
All right, awesome. So, just getting into it, I'm gonna ask you to get a little history from you, and then we're gonna get into some tests, okay?
Okay.
All right, so, notice you went to the doctor and everything. You got some pain in your right shoulder,
Yeah.
and you're a pitcher in baseball, so it's kind of due to, maybe a little overuse. You hurt yourself in practice, it says.
Yeah, I played college baseball, so.
Okay, can you point to me kind of where you're feeling that pain a little bit, if you can reach that far?
Yeah, like back here.
Back there? Okay.
Yeah.
All right, so, and you felt it at practice, you said?
Yeah, I was just throwing and kind of as I was coming forward, I just kind of felt a twinge, and it's been bothering me.
So, this was, I think it said a week ago or so. Have you, at kind of at its worst pain-wise, on a scale of 0 to 10, 0 being no pain at all, 10 being I need to go to the hospital at all, how would you describe it when it's kind of flared up on you, when it was then?
Probably like a 6 out of 10.
And what is it right now on that same scale?
Like a 2.
2? Okay. Awesome. All right, so just reading through a little bit more, haven't had any surgeries, and you didn't have any tests done here. Just want to ask, did the doctor kind of give you any things to kind of stay away from when you were sent to PT, or did she just give you free reins? Okay, awesome. So do you have any allergies of any sort?
Nope.
Okay. No latex, no lotions, nothing?
Nope.
Okay. And I just want to kind of just confirm some of this stuff with you. You're just a student and a baseball player at college, no job or anything?
Nope.
Okay. And so socially, can you tell me a little bit about your living situation? Do you live at home, apartment, house?
I live with some roommates.
Some roommates, okay. And do you drink at all, smoke, anything like that?
I drink occasionally, just like recreationally, that's it.
Socially?
Yeah.
Awesome, okay. So, last thing I just want to get into, is, other than baseball, has this kind of affected you in any other way that's keeping you from doing something that you need to do in your day-to-day life, or something that you enjoy doing?
Maybe just like working out and stuff, but I can do most things, it just causes some pain, that's all.
Causes some pain, okay. And as far as what you want out of this, can you give me a little bit of insight of what you're looking for out of PT?
Just get back to playing baseball.
Just get back to playing baseball? Good. Awesome. So, first thing I want to do, I want to take you through a system review, is what this is called. So, I'm just going to show you some motions, and I just want you to replicate these motions, okay?
Okay.
So, we're going to have you look up to the ceiling first. Awesome. Now look back down towards me and look to the ground. Good, okay. Now look to your right, my left. Awesome, back, and then look to your left, my right. Good. Now without bringing this shoulder up, I want you to bring your ear to your shoulder, like this. Good, all right. And now to the other side, as far as you can. Good. Did you feel any pain with that?
No.
Okay. So if you do feel any pain throughout any of this, just let me know, and we'll go from there, okay?
Okay.
All right, so I want you to bring your arms out to a T. All right, now we'll bring them down. Bring them up like we're doing the wave at a baseball game. All right. Now we're gonna have to actually stand with this one ever so just briefly, real quick, and now bring them back like this. All right, good. Now you can go ahead and sit back down. All right, any pain with those?
Not really.
All right, bring your shoulders like this. Can your elbows tucked? Give
Yeah.
yourself a hug.
Yeah.
Anything there?
Not too much.
Okay. Right here.
Yeah, that hurts a little on the right when I go like this.
Okay. All right. So bring them out like this. We're doing a curl now. All right, now release that weight. Good. Bring it back up like this. Kind of bring them over like that. Okay. Bring them out back like this, and let's do some windshield wipers. Okay, good. Make a fist. Release that fist, and do some sprinklers for me. Kind of like that. Awesome. All right. So now I'm just going to test a little strength, just some general strength, and just to kind of get a better idea of what's going on. All right.
Okay.
So I want you to shrug your shoulders for me. Don't let me push you down. 3, 2, 1. Good. All right. Bring them back out to a T. Don't let me push you down. Good. Don't let me push you up. Good. Bring them out just straight in front of you. Don't let me push you down. elbows again. Let me push you in.
That hurts.
That hurts, okay.
Yeah.
Go right here. Okay. So when we felt that pain with the strength and just kind of doing the motion, how would you describe those pains? On the same scale that we did earlier.
It's just like a quick, but it's like a 5 or 6.
5 or 6, okay. All right, so let's bring it up back up here, okay. Don't let me push it down. Don't let me push it up. Anything here?
No.
Good. Bring it back out right here. Okay. Don't let me push you out like this. All right, other way. Good. Push you out. Other way. Okay. Now I want you to we're gonna shake hands just for a second. I don't want you to let me bring your palm to the ceiling. Okay. Good. Good. Now don't let me bring your palm to the floor. Same thing on the other side. Don't let me bring your palm to the ceiling. And the opposite way to the floor. Good. Okay. Now I want you to take your hands like this, squeeze my finger as hard as you can on both sides. Good. Now let's make some fists again and try to come out of that and straighten your hand out, okay? Good, good. Straight like this, okay? You can bring your thumbs in too, and don't let me separate them. Okay. Okay. And are we having any pain with any of these that we've done recently since we've moved down to the elbow and below?
No.
Okay. Now, one more thing, back like this. Don't let me squeeze them together, okay?
Okay.
Awesome, good job. All right, so just want to take you through another little piece of testing real quick.
Okay.
I want to clear your spine, so I'm going to take you through a couple pieces. I'm just going to compress your head down if you're okay with that, and I want you to let me know if you feel any symptoms with this, okay?
Okay.
I'm just going to lower this table ever so slightly. So I'm going to go down, breathe, hold, release. Anything there?
No.
We'll extend this head a little bit. We're going to do the same thing. You okay there?
Yep.
Okay. Anything there?
Nope.
Okay. All right, last one. Was there anything there?
Nope.
All right, so just to kind of get that straight, the only thing we felt pain so far is kind of just bringing your arm out and a little bit in. You said that was about a 5 or 6, right?
Yeah.
Okay. All right. So I do want to get you on your stomach real quick, and I just want to feel around the area just to kind of see if I can feel any tenderness and see if you know how that feels for you. Okay. So go ahead and get on your stomach.
Jump
Okay.
this way.
We'll go this way so you can have a little air hole to breathe out of. Okay. And for the sake of the video, I'm only going to be testing one side for everything, but if I were to have more time, I would test both sides. Right there?
Yeah, a little bit more.
A
Yeah.
little twinge there, okay.
Yeah.
How's that feel?
It's a little tender, but it's fine.
On that same scale we did earlier?
That doesn't really cause it pain. And
Not any cause, just a little tender?
yeah, like
Okay,
two.
right there. Okay. So it's right there. You can go ahead and flip onto your stomach, or on your back for me, please. I'm sorry. Just want to check some range of motion. Okay. I think you're gonna get so we're just gonna go ahead and lift this up. Actually, if you could bend your knees a little bit and keep the feet flat on the table and just scoot towards the bottom of the table. Good. Gives me a little more room, you know?
Yep.
I like the shirt.
Thanks.
Must be a golfer wearing something like that.
Yeah, sometimes.
Wait a little bit.
Yeah.
Okay. So I'm just gonna take you through this. You let me know if you feel any pain through any of this, okay? Any pain with this?
No.
Okay. That's your 72. All right. mind if I keep going a little further?
Yeah, it's fine.
Right there is where I feel a little leave. Okay. Alright, how would you rate that paint?
It's like a 4.
You're a 4? Okay. Alright. So we got that going. Okay. Alright. So what we're gonna do next, you can go ahead and send that. We're actually gonna stand real quick. Do a couple tests. We're gonna do an impingement test first. So go ahead and stand for me. Alright, we're gonna have your arm like this. Good. And I'm just going to passively move this down. Okay, good. You move it back up. You feeling any pain with any of this?
Maybe a little, but not really.
Really? Okay. No pain with that, just a little bit, you said?
Yeah.
Okay, all right. So what we're gonna do now, I'm gonna have you just kind of follow what we're doing.
Okay.
Right here, take these cans, kind of like this, and we're just gonna kind of pour them out, maybe a little bit more inside. Good. I'm just gonna give a little pressure and don't let me push you down, okay?
Okay.
Good. Okay. All right, now you can go ahead and have a seat one more time. Okay. Just going to bring your arm out right here.
Okay.
And once I let go of your arm, I want you to take over, okay? Don't let it drop, all right? 3, 2, 1, go. And just slowly lower it. Okay. Do that one more time because it did kind of get you away, okay? All right, one more time, go. Right. Okay, nice. Awesome. All right. So, next we're just gonna have you stand up again. I'm sorry for all the moving. I should have arranged this a little better. So we're gonna face that way just so the camera can see. With this right arm, what I want you to do, bring it behind you, okay? Now I want you to lift it off of the small of your back, okay? Go ahead. All right, any pain with that?
Not really.
Okay. Now, I'm gonna have you lift off the small of your back one more time, and I'm gonna give you some resistance. Don't let me push you down, okay?
Okay.
3, 2, 1, okay? Okay. All right. You did give way to the resistance a little bit. So, leads me to want to do some MMT. So get back on the table, and we'll get on your stomach. Just gonna bring a towel underneath you. Can you a little bit closer there? Can you hold this position for me?
Yeah.
Okay. All right, don't let me push you down. 3, 2, 1, okay.
Just kind of hurts.
Do you have some pain with that?
Yeah.
Okay, how would you rate that pain on that 6 scale?
Probably like a 5 or 6.
5 or 6, okay. So you did about, you can go ahead and turn over while we talk a little bit, back on your back. Probably about a 4 minus on that, so there is a little weakness there. Trying to test this one too, so right here. Okay. I'm gonna put you in this position, right there. All right, now hold that for me. Okay. All right, I'm gonna try to push you up on it. 3, 2, 1, go. I see there's a little pain there, but you had, so no pain with that at all? Okay. So that was a 5 out of 5. Awesome, good job. All right, you can go ahead and sit for me. All right. So, actually, let's see. So, just so the camera can see, I want you to lay on your side. Actually, the way that you were, facing me.
On my side.
Yes. Right now, have you ever heard of chicken wing in your arm?
Kinda, yeah.
Kind of just bring it back like this for me real quick. I just want to check some of the scapular motion, okay? All right, you can relax it. Right there. You have any pain with that?
No.
It's about as far as I can get it.
That's my left shoulder.
this is your left shoulder, I'm done. Can you actually do this to the other side? Oh, man. You know, they don't send me here to figure out lefts and rights, even though I probably should.
Mix it up too.
All right, there's a little less motion here. Okay. All right. How you feeling with that?
It's just a little tender, just
A little
tight.
tender, no pain, or would you call that pain at all?
It's about the same as it was before.
Same as it was before. I got one
Yeah,
more of these
so
I want to
a
do.
little bit.
Okay, so. How's that feel?
It's okay. Hurts a little bit.
There, right there. There's a little part. Okay. Okay. You can go ahead and relax for me. So one more thing I want to do.
Okay.
Well, we can do it right here. You can just get on your back for me. Yeah, whichever way. Just go ahead and see how this works, okay? Alright. Go ahead and relax for me. How's that feel?
That's fine.
Pretty good range here. Alright, so in my findings, I think that he has some type of infraspinatus impingement of some sort. He was positive for the partial lift-off test. He had impaired strength and infraspinatus MMT, so he could possibly have a partial tear with that.